Halo, saya Ira. Hari ini saya bersama Dr Tan Kok Soon. Dia adalah seorang medical director dan senior cardiologist dari Orchard Heart Specialist. Hello, Dr. Tan.
Good morning.
Morning. Dr. Tan, today I want to ask you about cholesterol because a lot of people have high cholesterol and all. In the blood test, when you see the blood test report, right, there's LDL, there HDL. So we are always advised to lower our LDL. How does LDL and HDL actually produced by our body, and what is the connection with our heart?
Well, the cholesterol is just a fat because essentially we need fat in the cells and in the brain and all that to function well. But like all things, if you've got too much of a good thing, it's a bad thing. Yeah. So this is where we are, and usually the cholesterol is all produced by the liver.
Okay.
And to be honest, the amount of cholesterol that are being produced individually is probably majority-wise dependent on your genetic makeup. So certain people have a very abnormally high cholesterol level, and certain people will have a low cholesterol level,
Which is okay.
Depending on your makeup primarily. But having said that, your lifestyle is also very important when we come into that later.
Okay.
All right. And when we talk about cholesterol, which is fat in the bloodstream, we usually when we take a look at the fat, we divide it into three big separate components. One would be, we call the LDL cholesterol level, which is a low density cholesterol. That is bad for your system, bad for your blood supply, circulation, and may damage the system.
In what way?
Now, primarily, the bad cholesterol can damage your blood vessels. Primarily, blood vessels in your heart, in your brain, and possibly in the kidneys also. So people with very high bad cholesterol level are more prone to have heart problem, blockages in the heart arteries, more prone to have strokes, and probably more prone to have kidney damage in the future, or like blockages in the arteries going to the legs, causing pain in the legs, or very occasionally, instead of blocking, the arteries can expand and causes aneurysm. So cholesterol, bad cholesterol level can cause all these very bad issues with our blood vessel system. Yeah.
Okay. So then how do we actually lower down the LDL?
Yeah. Now the first thing is that whether your cholesterol is high or not, there's no way you can tell just looking at you. The only way you can tell what your level is to have a blood test. That's why every time you go see a doctor, especially a heart doctor, they will ask you to do a blood test to check your cholesterol level, because it's such an important factor in what goes on later with your blood supply. Yeah. So once you have seen the cholesterol level, you see that the doctor will tell you your blood cholesterol level is this level, your good cholesterol is this level, your triglyceride level, as I said, three components, is this level. Okay? And based on that, he probably can have an idea as to whether this is good for you or not so good for you, or whether you need something done to reduce your bad cholesterol or not. Okay. So first step, you have to do a blood test to be sure. Now, and by and large, most people, to be honest, would have a very high or highish level of a bad cholesterol level. And depending on whether you are young, old, and all that, the doctor may say, first thing you can do, although a lot of it is genetically based, is that you have to start on a healthy heart lifestyle. All right, that can oftentimes reduce your bad cholesterol if you do it properly by about 20 to 30%. So in other words, you have a bad cholesterol level of 100, you're really, really healthy, you can really bring it down to about 80 without taking any medicine, without doing anything too difficult. All right. So the things that usually the doctors will ask you to do, and this is a general recommendation, to have a healthy lifestyle. All right. Essentially, lots of exercise, eat healthy, lots of fish-based stuff. All right. Less carbohydrate, less fried food, less red meat. And when you do all that and reduce weight, obviously no sugary things. Okay. By doing that, you can actually lower down your cholesterol a bit. But in some people, the cholesterol is so high, or they have a very bad heart problem to begin with, that even that on its own may not be sufficient. And in those kind of circumstances, oftentimes the doctor will say you should take some medicine to bring it down, to protect further damage to your heart, to your brain, to your kidneys in the years going forward.
Okay. So, is there any side effect of the medication of cholesterol?
Now, the cholesterol medicine, there are a few types. The main kind of a cholesterol medicine that we use are called the statin group of medicine. This has been around for like 40, 50 years. And it's been very well studied, okay? Now, and to be honest, on balance, it's a very safe medicine. But however, like all medicine, there's always a small risk of side effects, okay? For instance, the statins type of medicine has been studied so well, but even having said that, in some people, a very small minority of people, they may have problem with aches and pains, muscle aches and pains. But even then, we suspect it may not be due to the medicine, it may be something else. Sometimes there's actually hint of damage to the heart, the muscles. Sometimes there's hint of damage to the liver or the kidney. But these are like more like allergic reaction from the medicine. And the incidence will be very low, like 1 in 100,000, 1 in a million or so, okay? And invariably, it's not an issue because even if this were to happen, if you're one of those unlucky people that have an allergic reaction to it, the doctor usually will know because oftentimes when they start you on the cholesterol medicine, they will always ask you to have a check 2 months, 3 months later, and oftentimes they will check your liver function, your kidney function, or your muscle enzymes function to be sure that everything is okay. Because it's an allergic type reaction, if you are okay, you are very unlikely to have a problem long term. Yeah.
Okay. And sometimes I hear people like, okay, I'm not eating any oily food or anything, so I take my cholesterol medicine when I eat oily food. Is it good to like take on and off, or you must continually take the medicine?
The concept is this, in the sense that we know that the cholesterol per se, the high cholesterol level, is the one that's damaging the heart.
Yes.
But the damage doesn't happen like immediately, right? It happens over years, in fact, okay? And every time you take a cholesterol medicine, your cholesterol level will go down a bit, all right? It's no use, it's not really no use, because at the end of the day, you're not really treating the number. You're actually trying to prevent your heart from being damaged by the cholesterol, high cholesterol level. And the argument is that you have to bring it down and keep it down low for as long as you are prepared to do it. So it's usually, if you want to take medicine, you really should take it
regularly.
long term. If your doctor suspects that your cholesterol level is high enough to take medicine, okay? So I think you should take it daily if you are asked to do so.
Okay. Thank you so much for the information, Dr. Tan.